We go now to our reporter Laura Windsor, who has a report on what are called cooling blankets.
For every 1,000 babies born, 1 or 2 will have brain injury because of lack of oxygen during the delivery. Placing the infant into a cooling blanket quickly reduces their body temperature to allow for healing. We spoke with Dr. Laurence Shaw at Vally Presbyterian Hospital in Van Nuys, California, who describes how the cooling blanket functions.
A cooling blanket is a method of treatment to assist infants who've had distress or difficulties before and during their delivery to have a better outcome. What it is it's a way to take a baby's core temperature down to about 33 degrees. It is cool to the touch, but it's higher than even room temperature. Our bodies are usually at somewhere around 37 degrees centigrade. We're only going down 4 degrees centigrade, which is about 10 degrees Fahrenheit. And maintain it there for 3 days while the baby's body compensates for the acidosis and the metabolic problems that he has, and then we rewarm them and see what their function is. Cooling blankets are used in NICUs, neonatal intensive care units, to assist infants who've had perinatal insults. We have a team including a physician, respiratory therapists, and nurses that work closely with the baby over the period of the cooling, which is only 3 days, in order to assist them. And after that, then they're followed in a normal neonatal intensive care unit.
Dr. Shaw tells us how he determines who needs a cooling blanket.
There are babies that are over 36 weeks who, during their prenatal or delivery time, end up with low oxygen levels or low nutrient levels, and they're born with what we call ischemic hypoxic encephalopathy. What it means is that the brain hasn't gotten sufficient nutrients and oxygen in order to function, and so the body is starting to break down. In babies, it's different than in adults because a lot of those areas that need to keep developing new nerves for brain cells, for us to learn and everything, can be damaged and ultimately lost. This is a method of trying to preserve as much of that growth area so that they can have a normal development outcome and live successful lives.
According to Dr. Shaw, babies can tolerate the cold temperature of the cooling blanket.
They tolerate it really well. Their heart rates do slow a little bit, kind of like somebody in hibernation. They sometimes need to have assistance with breathing, and of course they need to get nutrition, which we can give them as well during that period of time. And we just let their bodies stay kind of on pause. The blanket is filled with water that comes from the machine. When we get the baby here, we're going to put the baby onto the blanket, and then we'll start the control. It's an auto control. Set the temperature that we want to go down to, and then it will cycle over a period of 2 to 4 hours down to the temperature which we can monitor here. We're also going to put a temperature probe down into the baby so that we can monitor the baby's inside temperature. The reason that this protocol ever started to use cooling is that about 2 to 5 out of every 1,000 infants can develop hypoxic ischemic encephalopathy, or this problem at the natal or antenatal time. Of those, approximately 1 in 6 would possibly die or have severe developmental problems without this particular treatment. So we are making a difference in both the number of babies that live and those that live that can do well as far as their development in school and later on have productive lives.
Traditionally, there was nothing doctors could do to prevent a lifetime of disabilities resulting from this brain damage. But now they're using this simple blanket to save brains and change lives. For the American Health Journal, I'm Laura Windsor.